Good morning and good afternoon to everyone, and welcome to this session on fecal sludge management. I'm Claire Papin Stammose. I'm representing Tufts University, and we prepared this presentation with Daniele Lantagne from Tufts University and Catherine Bourgault from CAWST. Our topic today will be consideration for implementing sustainable fecal sludge services in humanitarian context. This research project was funded by BHA USAID. The main objective of this research project was to improve the planning of fecal sludge management activities in emergency response from the acute to the stabilization and protracted phases. To fulfill this objective, we collected data from three main sources. The first one was literature review, the second one was key informant interviews, and the third one was field visit of fecal sludge treatment plants. For the literature review, we conducted a systematic review of 6 databases, 34 websites, and we included 41 documents. Within these 41 documents, we identified 241 barriers and 348 facilitators to sustainable fecal sludge management in emergency context. And we analyze these barriers and facilitators, and we categorize them into 11 categories. This slide is presenting you the main result of this literature review. In orange, you can see the barriers, and in blue, the facilitators. The main barriers which were identified are performances and robust technologies, land difficulties, which can include quality of land, but also land access, and also existing capacity, and also difficulties in operation and maintenance. Regarding the facilitators, the main one was related to existing capacity to operate the fecal sludge treatment plant. Then you have the quality of the fecal sludge treatment plant itself with performances and robust technology. And the third one is safely reusing sludge or effluent. For the key informant interviews, we developed a guide with 18 questions, and we conducted 20 key informant interviews. Among these 20 key informant interviews, 35 were conducted with women and 65% of them were conducted with men. And among the participants, 50% were experts at field level and 50% were experts at international level. Each one of these key informant interviews lasted around 1 hour, and the respondents were from 13 different countries. These are the main results from these key informant interviews. As we did for the literature review, we identified main barriers and main facilitators. For barriers, difficulties in operation and maintenance were mentioned 95 times during this key informant interview. Then the second one was the lack of financial viability for these FSTPs. Then we found out like knowledge gap in FSM is an issue for most of the respondents. And then you have institutional support or involvement and land difficulties. Regarding facilitators, the first one was robust technology. The second one was modularity of selected technology. Then the third one was culturally appropriate solution, considering the entire sanitation chain as an outset, having built capacity, having community involvement, the feasibility, the ecological sustainability, and the possibility to safely reuse sludge or effluent. The third source of data was from field visit of fecal sludge treatment plant. We conducted 18 visits of different fecal sludge treatment plant. 3 of them were in Germany, 3 of them were in Tanzania. We visited 6 treatment plants in Jordan, 1 in Cameroon, and 5 in Lebanon. Here are the results of this field visit. For the barriers, the main one was land difficulties, and as mentioned, it can be either like the quality of the land or just accessing land. Then you have institutional support or involvement. the financial viability, knowledge gap in FSM, difficulty in operation and maintenance, design capacity which doesn't match the needs, and cultural acceptance. As facilitators, the first one was temporal, meaning having the time to operate the treatment plant, but also to monitor the treatment plant. The second one was monitoring progress. The third one was the financial viability. Then it's having built capacity, an easy operation and maintenance, the cultural acceptance, safely reusing sludge and effluent, the modularity of the technology, and the robust technology. We merge all these results into diagram. This diagram is for barriers, and we try to identify common barriers. In the middle of this diagram, you can see the barriers which were identified from the three main sources. We identify 5 common barriers, which are land difficulties, knowledge gap in FSM, lack of financial viability, difficulties in operation and maintenance, and lack of institutional support or involvement. Then you have different barriers which were identified in only one source, like these are the one for the literature review, and this is the one from site visit. And then you have cultural barriers which were identified in site visit and literature review. These are all the criteria which were merged for the facilitator from key informant interview, site visit, and literature review. The same as the previous graph, at the middle of these 3 circles, you can see like the criteria which were common from key informant interview, site visit, and literature review. We identify 4 barriers, 4 facilitators which were having built capacity, performance, culturally appropriate solution, and safely reusing sludge or effluent. And then you have 4 other facilitators which were shared by 2 sources, which are financial viability, easy operation and maintenance, temporal, and the modularity of the solution. And then the other facilitators were just identified in 1 source. Based on this data, we are coming with 8 recommendations. The first one is to integrate sustainability at the earliest stage of an emergency situation, then to choose modular technology to adapt, to align effort with local institutions, to foster community ownership in participatory planning, to design culturally appropriate solutions to reduce stigma, to improve data system for performance monitoring, to develop flexible funding model for rapid and long term, and finally to advocate for integration of FSM into broader WASH. We would like to thank you for your participation today, and you have here our 3 email address. Thank you.